Health Ministry is against the reopening of schools without proper preparations and plans. The association now wants the government to prove that schools are safe for reopening and provide evidence that the epidemiological pattern of the pandemic is well known before reopening. Now, medical practitioners across the country now want the government to put clear plans to contain the COVID-19 outbreak in schools. So now let's speak to Were Onyino, who is the KMA president, on what are the bare minimums before schools can be reopened. Thank you so much for talking to us here on a KTN News Center. So KMA says that schools should not be reopened, but on the other hand, the Minister of Education, Professor George Magoha, says that they've put in place enough measures, and also World Bank has given money to the government to monitor the learning process once schools reopen.
Thank you, Brenda, for having us today. So I think let me clarify the position of Kenya Medical Association as far as opening of schools is concerned. Our position is we recommended actually the opening of schools, but it should be done in a phased manner. And that's why we said let's the finalists who are doing the exams, these are the class 7s and the form 4s, they should be allowed first to go to school, and then we monitor and see how that pans out in terms of either the outbreak or how then the returning to normalcy in our schools is implemented. So what KMA actually said was we should reopen schools, but you should have the contingency plans in place. And as you have heard in the article, most of the stakeholders actually do not have copies of that report, so that they can actually read and see these contingency plans that are in place in case we have outbreaks. I can give you an example. In South Africa, when schools were opened, they had to quickly go back and shut them down because schools formed new pockets of infection that actually contributed to the second wave in the South African government.
Right. So right now, as we speak, the country's COVID-19 case stands at 38,529. And some of the medics, some of them are saying that the country is not yet ready for reopening schools because the government is not doing enough when it comes to mass testing and contact tracing. The numbers are just, the figures are just given out probably from the figures of infection comes from the people who've gone for testing at different medical facilities.
Yes, for sure, our testing has not actually met the recommended standards for us to actually use that data, as we mentioned over the weekend, to actually inform the full opening of the economy at once. And we have recommended that we do this in a phased manner. And as we do it in a phased manner, then we should be able to ramp up our testing, because in schools, as we open up, we need to continuously do surveillance in those schools so that we ensure, especially for the boarding schools, so that we ensure that they do not form new pockets where we'll have infections, new surges of infection coming up. And if, for example, in a certain boarding school, then we have a breakout of a COVID-19 infection, then what do we do? Because we all know that the schools used to be the treatment and isolation centers. So now that none are back in school, so what contingency plans do we have in our counties? You're well aware some of the counties have actually closed their isolation facilities, which is very worrying. And those are the things that, as an association, we are saying, yes, let's open schools, but at the same time, let's have these contingency plans in place. Yesterday, you saw a circular saying that when you open a university, they should be linked, and our colleges, they should be linked to a health facility. As an association, we want to say, to recommend even we move a step further, that as we open the schools, as we link them to health facilities, let them also link them to a qualified healthcare practitioner. This is a medical doctor who should be able to provide support and guidance to the teachers and the administration in school as our children resume school.
So as you speak right now, are you confident that should the government say, you know, the candidates, that is the Form 4s and the Class 8s, need to report back to school probably by the 5th, that is on Monday, the 5th of October. Are you confident that the measures that have been put in place will be enough to protect these students?
We are confident, and actually are confident that Professor Magoha and his team have actually done all they can, because this is it's a new normal to us. It's a pandemic that you've never experienced. We are confident that they have actually put plans in place, and actually we're just waiting to have a meeting with them to see how we are going to now ensure that we participate as the medical fraternity. This open and operationalization of this plan to open schools. Confident that the Minister of Health has done what in circumstances. Continue doing more acts. They should ensure that all our schools, as we go back, have enough sanitation facilities in place. All our schools have enough space in terms of putting up the tents, where the desks, to ensure there is social distancing, and to ensure that our teachers tested routinely, to ensure that we do not have transmission from the teachers to the children, and also we have some form of testing for the children so that we do not have new pockets and new surges of infection coming from us, to force us to close again.
Right, and let me just pick it up from that, what you've said, that you're talking about testing of teachers and children. So this testing, how often should it be done? Should it be done after every 14 days?
Yeah, recommendation, as we said for the weekend, we recommend at least they should test every 14 days until we completely flatten the curve, and then you can review that recommendation there.
All right. Now, of concern to many parents, and especially some education stakeholders, is for the young pupils. And when I'm talking about the young pupils, I'm talking about the ones in PP1, PP2, and about class 3, because they say that some of them are so close to their friends. They don't know about social distance. They don't know about wearing the mask throughout. And one of the conditions that have been put in place by the World Health Organization, it's in terms of the age of children who are supposed to put on masks.
Of course, it's very hard for you to say distance when they go back to school. But the good thing that as we have been learning these new virus, this coronavirus, most of the children tend to have infection that they quickly get out of it. It's just like a cold. So I don't think it should worry us so much. And the good thing, we have experiences from other countries where they've opened and we haven't seen, and even if you look at the data provided by the Ministry of Health, above 1 year to 5 years, from 1 year to around 10 years, actually, most of them are actually spared. Our main worry is the older children, especially in our colleges and in high schools. And these ones, we can be able actually to enforce the social distancing and to avoid any transmission of infection. So we don't need to worry so much about the children. The ones that we need to be careful are the children who might have any comorbid conditions, children who are asthmatic, children who maybe are diabetic. These are the special group of children that we need to pay more attention in terms of how we're going to protect them when they resume school.
All right, thank you so much, Were Onyino, who is the KMA president, talking to us about reopening of schools, what precautions that, the bare minimums that should be put in place by the government before schools reopen. Once again, thank you so much, Were Onyino. Now, to matters politics, where ANC party leader Musalia Mudavadi is urging Kenyans to be wary of politics of deceit and deception ahead of the